Now I'm going to walk you through each one of the hand pieces, techniques, and the order in which you're going to be doing your treatments. First, I'm going to suggest that you always have your patients come in with clean, dry skin. I understand that depending on, the circumstances, they may not be able to do that. With that being said, because of the order that we're going to do this, I do recommend having some gentle cleansing wipes, wiping their face off before you do anything. The reason being is you're going to start with the hot cold hammer, specifically in heating mode. So you're going to go to your fire and ice button. It's right now set to cooling. You're going to set it to heating. It defaults to 32. You can increase that if you want to. If you want, for instance, to expedite the treating, you can increase it. So we're going to increase it a little bit, and then I'm going to start it. It will take a little bit for this to get nice and hot. So if you know that your patient is coming in, you can preset this so that it's nice and warm when they get in the chair. Now, the technique in which you're going to do this and the reason you're doing this, why are we going to heat the skin up? We know that heating increases blood flow to the area for nutrient diffusion. It's also going to help open the pores. We want to do this before we do hydrodermabrasion to get all that yucky stuff out of the skin. So you're just going to apply it to the skin and you're going to roll it around and move it to the next area. Again, the whole goal of this is to just get the tissue nice and warm. Next, we're going to do a hydrodermabrasion treatment. So we're going to go to our hydroderm. You can hear the vacuum kick in. The vacuum is going to help suck up each one of your solutions. What's very important is when you're using Image's solutions, they are very active. They have a lot of active ingredients in them, a lot of acids. So we don't normally recommend using 1 and 2 in the same treatment. Now, 1 is for anti-aging and blemishes, 1 is for acneic skin. So if your patient happens to be, and it's rare, but if your patient happens to be both acneic and is also wanting anti-aging or for dark spots, you can just alternate those treatments. So 1 week they come in for acne, the next week they come in for brown spots or anti-aging. Okay, so you're going to have your Hydroderm tips, these little green tips, and this is your Hydroderm handpiece. There is an O-ring to keep it nice and tight, so you're just going to put this down over top, and then it's locked into place. Now, you're going to choose your solution that you're using. In her case, we're going to use 1, and then you do have a timer setting. It's up to you, again, how you're customizing your facial, how long you spend doing this. But we're going to increase vacuum to 5 for her and flow as well. Remember that you're going to want to prime this tip. So you're going to want to hold this down and you're going to want to wait until you see or feel the solution coming up into the handpiece. We're going to hit start and we're going to treat on her skin. Now, because you do have the vacuum, you're going to want to hold the skin taut as you pull up towards the lymphatic system, right? So always up and away, the way you want your face to go. So hold the skin, pull down under the eye. Now, what I love about these, especially with a small tip, is getting nice and doing some extractions on the nose. So getting nice and tight here. And then if you want to do underneath, same thing you're going to do towards the lymphatics. If you are doing the neck, down towards the heart. Okay. After you're done doing your hydrodermabrasion treatment, you're going to take the tip off. And you're going to take your handpiece and you're going to put it in the cleaning port upside down. Okay. Now you can go ahead and do your cleaning cycle. As you see, it's set to cleaning now that we finished. You have a 1 minute 20 second, and you're going to hit start, and it will the device will go ahead and clean out that tip. Once we are done with hydrodermabrasion, we've cleansed the skin, we've sucked out all that yucky stuff. That's going to go down into your waste basin. Again, remember to clean that out or dump that at the end of every day or when the device tells you that it's full. Now, my suggestion is when you're customizing your facial, and as you go into each additional modality, we're going to do it based on the fact that the beauty of the CytoPeel is that we can treat all living layers of the tissue. So we're going to want to go deepest to shallowest. Now, we mentioned that you have one cord for a multitude of different handpieces we're going to start deepest with our iontophoresis and microcurrent. What this handpiece is going to do is it's going to use an electrical current that's going to do two things. It's going to stimulate the muscles. That's why we're starting deep in the muscle. And it's also going to help lift. And those same currents are going to open micro pathways into the tissue to allow you to push different topicals into the tissue. Now you can use your own. We're going to suggest that you use our stem facial cytokine growth factor solution. This is your stem facial. So it's in a roller form, so you don't waste product. And with this handpiece, we're going to have three motions. We're going to do jawline. So I'm going to go rub this on. And we're going to straddle the jawline with each of these two electrodes. So we're going to go to electro-ion. We're going to hit, you can change your energy. We're going to increase energy to a 5 again. And we're going to hit start. You'll know that it's on when you have that blue light. So again, we're going to straddle the jawline and we're going to pull up on the tissue. Again, we're going to do this the way we want our face to move and lift. So you'll do a few passes. Then we're going to want to straddle the cheekbone. On some patients, you may notice that they have a little bit of a muscular jump. That's just the stimulation of the muscle, which is what we want to do. It's a good thing. And then the last thing we're going to do is lift the brow. So we're going to apply our stem facial again. And we're going to lift the brow. I always really like doing this on one side and then showing the patient the lift after the fact. Okay. Next, we're going to go into ultrasound. You have different energy levels here that you can use. This is a higher frequency, medium, lower frequency. This is just going to change how the depth of penetration is with your ultrasound. Again, we're going to increase the energy. We'll go to 5 and we'll start our treatment. When you're using the ultrasound handpiece, you're going to use ultrasound gel. You're always going to want to use clear ultrasound gel when you're doing this. Apply about 2 millimeters to the area that you're treating, so full face. And then you're going to, again, move in the same direction that you would your hydrodermabrasion. You're going to move along the lymphatics, again, lifting the tissue. And with this, you can do small circular motions or linear motions, whatever you choose. So you'll do that throughout the face, and then you'll be done. Anytime you have residue on the skin, whether it's your ultrasound or after your bore effect, that's the reason they provided you with an ultrasonic scrubber. So you see on the ultrasonic scrubber, where's the scrubber? The scrubber's here. And you have an angulation on the scrubber as well. Then you have an indication of peeling, deep, or micro massage. This is just going to depend on what it is that you're doing. For the most part, we're just going to want to peel away what it is that we have on the skin in between your different modalities. If you do want to do a deeper pull, if you will, extractions, maybe you want to get nice and tight into the nose, you can do that. And the micro massage, you're actually going to massage into the skin. Typically, we're not using that, but if you so choose, you can. So we're going to hit scrubber. And then you're going to choose, you can either choose on your handpiece, which one you're going to do, or here. And then you're going to hit start. Now you can hear the vibration. And we're going to peel away what is ever on their skin. Again, same motion. Okay. Next is radiofrequency. Radiofrequency is going to be a heat-based treatment. We're going to hit RF, increase to 4. This is the only handpiece where you have a specific amount of time that you need to do this in order to achieve the biological response that you want. What radiofrequency does is it causes a microthermal trauma inside the skin, and that causes your little fibroblasts to create new collagen and elastin. So this is going to thicken the skin. It's also going to help tighten the skin. Same as your ultrasound, you can do linear motions or small circular motions, but you have to do this for a minimum of 10 minutes to achieve the heat or the temperature that you need to in order to stimulate collagen and elastin production. So we're going to hit start. You have 30 minutes, but like I said, minimum of 10. Why does it give you that amount of time? Oh, one more thing. You are also going to use ultrasound gel with this. It's a conductor and an insulator for the skin. So you're going to apply a minimum of 2 millimeters all over the skin, and then you're going to go in those circular or linear motions over the face. So you're going to do this for a minimum of 10 minutes so that you achieve that dermal collagen remodeling. This is your bore tip or your carboxy therapy. You have different options of tips that you're going to use based on the patient and the need and the customization of the facial. So you'll have brightening and you'll have a shining, but this is going to help exfoliate, 1, and 2. There's an activator gel that comes with each one of the tips. So your bore tips, they come in like a little pod, if you will. You're going to peel back the top of the pod. You're going to take it out. You're just going to place it in here. You'll hear like a little click. It'll stay nice and tight. And then you're going to take your activator gel and pour it into that pod, because then you can just dip your tip into that activator gel. And same thing, you're going to do circular motions on the skin. So let's go to your bore effect. You can increase your energy or increase to 5 and hit start. You do see that there is an infrared light, so you get the benefits of infrared light here. And you will notice that it starts to bubble. The whole point of carboxy therapy is those little bubbles release CO2. And that gaseous response, your body is going to send oxygen. Again, what does oxygen do? It's going to help with nutrient diffusion. So you're going to get an exfoliation, you're going to get nutrient diffusion, you're going to get the benefits of what's in the activator gel and what's in the tip. And you are going to do those same circular motions throughout the face in the direction of the lymphatics. When you notice that it's getting a little dry, tip it back into your activator gel and keep going. This is your oxygen jet. You're going to pour your solution here. This little tip comes right off. You pour your solution in here, and then you're going to spray this onto the skin. You can customize your spray or change the amount of spray that comes out by twisting this little end piece, but then you just push this button, pull it back, and it will spray. So we'll go to your O2 facial. So you can hear it. I can change how much spray goes in or out, and then you're going to spray it on the face. Patients love this. It feels amazing after the facial. So that's your oxygen gel. That in and of itself is your CytoPeel V3. Have fun.